Hello, Healing Spot community. This is Justine Calderwood with the Healing Spot Physical Therapy, and today I am talking about ways to keep your lower back happy. So in June, we're talking about ways to keep your body happy, and today we're covering the low back. So welcome. I am going to go over some really helpful tips that I feel has been very helpful for my patients that I've worked with over the years. With back pain, it's super common. So if you're tuning in and you have back pain, welcome. So one thing that I want to say is, so I'm going to go over kind of like some specific tips as I go along, and just because of how my room is set up, I'm probably going to do the stretches afterwards. So bear with me here as you learn some really good tips. For one, I want to really encourage you to look beyond your back, okay? So when you are considering your back and you're having pain, and especially if you go to somebody and they're looking at you and they're looking at your back and they're looking through this tiny little hole and just kind of managing your symptoms instead of looking at you as a whole person, considering your history, what's going on mentally, emotionally with you, what kind of work do you do. When you're not looking at all of those clues, you can start to miss what to do for you specifically. So I want to just throw out a disclaimer there that I'm going to give you some of my best tips as a physical therapist. But honestly, I can't give you all the tips that I have in my tool bag because without evaluating you, I'm just going to give you some general things. So keep this in mind, that I feel like the best place for you to get a solution to your problem is to have somebody in person. Okay? We'll talk about that a little bit more. So one, I want to just say that stretching, okay, so a lot of people are very, very tight. This is what I find over the years, that people aren't only just tight into, the front of their hips, their hamstrings. People think, oh, I better stretch my hamstrings because I have back pain. But you still need to be looking at the front of you as well. So hip flexors, the IT band, your glutes, all of those can contribute to some back pain. Your pelvic floor muscles, that's the bottom of your back, okay? So if you're not doing anything to address the inner thighs, the pelvic floor, you might be missing a little bit of that, okay? And then also don't neglect your upper back and your shoulders, because this contributes to our posture, and that can take a strain on the back side and lower down in our back. So don't neglect even the upper back, okay? Don't sit too long, okay? In our society, I think this is why a lot of us are so tight, is we're sitting, we're more sedentary than our ancestors, that had more laborious jobs and activities. So sitting too long really takes a toll on the back. If you travel for your job and you have a really long commute, take that into consideration. I saw a gentleman recently really feel like his back pain was caused, he had a disc issue, was caused by this 2-hour commute he had 4 days a week. And so really be looking at that and paying attention to your body. If your body's screaming at you and you're ignoring it and you're doing that long enough, something is going to give. Your body has these warning signals to tell you that you're in pain for some reason. So don't ignore them. Rest when you need to. Get some help. Let's see. So if you can, even set your phone reminder, or on your computer a reminder. Get up every 30 to 45 minutes and stretch. Walk around. When we walk and we're moving, what happens is the discs actually get a chance to rehydrate. When you're sitting too long, they start to dehydrate. Your ligaments start to what we call creep. They start to really stretch out, and so that can compromise your back. So get up, get moving around so that your body can get blood flow to the area and those discs can get nourished again, okay? Go for a walk on your lunch break if you have that ability. Get out and move a little bit, okay? Be exercising. That's one thing that can really let go of some endorphins, can release endorphins in your body to help with some pain relief. As you know, I'm a huge fan of essential oils to help keep joints and muscles happy. Panaway is one of my favorites. Peppermint is also a good one. Can get into those joint spaces, can get into your and help the muscular support. Cool Azul, and even this Orthosport. So these are essential oils, and this one has a carrier oil with it. But what the essential oils do is they get in there. They're very tiny molecules, and they help to get in and support the body. Let's see, alternating between sitting and standing. Let's go back to that. So if you do sit for a long period of time and you have a desk job, get a standing desk where you can actually, raise and lower it so you have that flexibility. It's well worth the investment. You may look at that and go, oh, I can't afford that, or my employer isn't going to pay for that. Pay for it yourself, guys, okay? It's worth the investment. You are worth that price of a standing desk if it's going to make a difference to your back and keep you productive and keep you happy in life, okay? Let's see. I don't have this in front of me, but I give every one of my patients a small ball. I am a big, advocator for patient education, self-care, and I teach people how to use it. Good places to use a small ball, again, into the front of the hip. So your hip flexors, below your ribs, even as far down as the hip crease. Put the ball there, lie on top of it, or even just press the ball into that area. That will help to release the psoas, the iliopsoas, the iliacus. Those are muscles that are collectively called the hip flexors. You can put it in your low back, on either side of your spine, lean against it in a chair or lie on top of it, and hold it there for up to 5 minutes or longer if it feels okay, but really drape your body over it, okay? That gives a really good way for your body to release the soft tissue. That's one thing that I do a lot with my patients is actually address the soft tissue. It can put up to 2,000 pounds of pain and pull and pressure in the body, okay? So holding that longer period will allow more permanent changes in your body. Let's see. Look at your pelvis as the foundation of your back. So I tell people don't neglect your pelvic floor. There's some good screening tools to see if you have actually pelvic floor dysfunction versus low back issues or SI joint pain. A good one that I love is the Cozean, Cozean questionnaire. Reach out to me if you want to put it in the chat box right now. I can get that to you. That will help you determine if you have possibly a pelvic floor dysfunction versus a low back, because you can have some referred pain to your back because of the attachments of the pelvic floor from the bottom and onto the sacrum and onto the coccyx, okay? All right, awesome, Susie. I'm glad to hear that you're using your ball. Let's see, core strengthening. So there's a difference between inner core and outer core. And if you're super strong in your outer core but weak in your inner core, that can lead to some low back pain because you don't have the stabilization that you need in your back. Okay, so that's the transverse abdominis, that's the multifidi muscles, and that's the pelvic floor muscles. So if you're doing a lot of back extensions, a lot of crunches, a lot of oblique work, you might have a super strong outer core, but a very weak or not engaged inner core, and that can make a huge difference, okay? Strengthening big body parts too. So I like to start with inner core strengthening, work on outer core, kind of work out from there. So then I work on, say, glute strengthening, work on the hamstrings and the quads and things like that, and doing some more higher level things. But you need to get that inner core activated before you start adding on. Maintain a healthy weight. I get a lot of people that ask me this, especially men that tend to have a little bit extra weight here. It's not always men, it's some women too. But they ask me, well, does this have anything to do with my back? Yes, absolutely. When you have all this weight pulling you forward, imagine what's happening here. You're arching through your back, okay? So really make some efforts to eat healthier, get a little bit of exercise. Start taking control of your health and making those uncomfortable decisions that you need to make to lose some weight. Your back will thank you for it, okay? It's put a lot of stress on your ligaments and your joints. It's going to make a big difference, okay? Considering your diet. So I'm going to go to that based on just inflammation. I have people that are like, gosh, suspect that they have some maybe allergies or sensitivities, and it's causing a lot of inflammation in the front side of their back, into their stomach. So if you have irritable bowel syndrome, if you have issues with bowel function, like you're going too often, you're not going enough, that can contribute to back pain, okay? So consider that as well. So kind of throwing some things out there that you might not have considered. So what I'm going to do here is I'm going to show you a few stretches. I love to do myofascial stretches. So when I do that, oftentimes when people come in and they say, hey, I've seen someone else for physical therapy, or I've seen somebody that told me to do some stretches and it's not really working, I'll go, okay, well, how long are you holding? Oh, 30 seconds, a minute maybe if they're lucky. And I'll say, okay, those are great stretches, and I'll evaluate that. But I'll say, okay, that's great, and those are great stretches to do, but slow it down, okay? So that way you're really targeting the fascia, the soft connective tissue. So hold your stretches for 3 to 5 minutes, okay? And then sometimes I have to modify things. People are given stretches that when I tell them to start holding longer, it's like, well, there's no way I can, say you've been given a hip flexor stretch standing like this, it's like that's hard to hold for 5 minutes. So I'll give them something that's a little bit easier for their body to be able to maintain for that 3 to 5 minute mark, and really teach people how to mindfully pay attention to what their body's doing when they're stretching and exercising, okay? Because it really does make a difference. So I want to just show you 3 or 4 different stretches right now that you can get started with, but do know that the best solution to your problem is likely getting a personalized look at your back, okay, to find out what's going on, what you can do about it, so you can get some education and some homework that you can do at home. A lot of people think that we, as physical therapists, just do throw exercises at people, and while that's true, we do like to educate, we do like to show you what you can do. There's a lot of things that I do with my hands. That's primarily what I do when people are in my clinic, is to help them release these restrictions in their body so that their posture is better, so that their joints are less strained, and we bring balance back to the pelvis and back to the spine. It makes a huge difference. Then your home program is really going to make a big difference to you, okay? So having that customized look at you and feel of your body so you can get exactly what you need, okay? So seek out a physical therapist. I'm a big advocate because I have seen it work so many times. We're really movement specialists. We're able to do some differential diagnosis with you as well. So I'm going to move the camera back a little bit and show you a couple stretches before I sign off. So I'm going to show you, there's a lot of variations on stretching, okay? So just to be simple, I'm going to show you 3 things that you can do while lying down that may be super helpful for your back, okay? So what I'm going to do is first show you a hip flexor stretch. So I'm going to take the pillow out, and I'm just going to lie down. So I'm going to show you how to stretch the left hip, okay? So I'm going to be right on the edge of the table. You can do this on your bed at home or even a couch. And what I like to do is be here and lie back and let that leg hang over the edge of the table, okay? And the other leg can be bent. That way you're supporting your back, okay? And then what I like to do, ideally that foot should be on the floor, okay? Or use a stool or a box or something like that that you can support your foot with. And then you just bring your leg back so that you're stretching in through the quad muscle here on the front of your thigh and really up into the hip, okay? So the further that I bend my knee, the more stretch I'm gonna feel in this left leg, okay? So that's the hip flexor stretch. Again, hold for 3 to 5 minutes.
Okay.
Another good one is to stretch the glutes, okay? So those are the muscles on the backside, your buttocks, okay? So a good stretch, we're gonna start here on the left, is to bring the leg up, bring your knee up towards your chest, so you're feeling it in the backside, okay? Now, if you're really tight, you may only get to here, or if you have hip issues, trying to keep this simple. But you can just bring it straight up to the same side shoulder. Hold that for 3 to 5 minutes. You can even work on bringing it to the opposite shoulder to change where you're feeling this in through the hip. Piriformis stretch, you're gonna do this. So again, on the left side, you can bring that foot up, rested on the opposite leg, that's bent. You can do a couple things here. You can either kind of loop through here and bring your leg up if you need a little extra stretch, or you can stay right there and push the knee out a little bit, depending on your flexibility starting with, okay? So again, you just kind of push the knee out, hold that for 3 to 5 minutes, or you can thread through, grab a hold behind the opposite knee so you're not stressing the knee, and you can bring this leg up. And I'd like to use my elbow on the other side to keep that hip open, okay? And you should feel this really deep into the buttock. You may feel it down into your thigh, depending again on your flexibility. Okay, let's see, another great stretch, I'm just going to go up a little bit, is to stretch out through your shoulders. So I like to use something like a pillow or maybe even a towel. You can put this here so it's up along your upper back. It's just to lift up your chest a little bit. And what you can do from there, legs can be out straight, and then you can do the stretch in through here. Okay, and that helps to open up. Like I'm feeling it into my hip flexors with that, okay? And into my chest, and I don't have my head supported, so I can feel a stretch into the neck, okay? Because you can imagine if you're tight all through your chest and the front of your neck and in here, what that's doing is pulling you forward, and you're gonna feel that strain in the back, okay? So hopefully that is helpful for you. If you guys have any questions, please leave them below. Especially if you have questions about that Cozy In questionnaire, I will get that for you. And thanks for tuning in this Tuesday. Talk to you guys soon. Bye-bye.